Patients are always asking, what type of breast implant should I have, doctor? They heard about gummy bear implants, which were used, a decade ago. They've really pretty much gone out of style now because they're too firm. And they often have a textured surface, and we don't want a textured surface. So our implants today are smooth, and they tend to be round. The nice thing about a round implant is that if it rotates, it's not going to create a problem with regard to appearance. It's still going to be symmetrical. So we're using smooth, round implants. So the decision is, well, what type should I get? Should I get saline or silicone gel? Saline, the implant contains salt water. Silicone gel contains silicone gel. The shell is really very similar between the two of them. So what are the advantages and disadvantages? Well, if a saline implant leaks, it's of course just water that leaks into your system, not dangerous. The implant deflates though, and so it's like a flat tire on one side, and women need to come in and have the implant replaced. Silicone gel implant can leak, but if it does, it tends to be in small amounts, and the silicone is contained within the capsule that the body forms around the implant. Oftentimes, patients don't even know if there's a small leak with a silicone implant. A lot of women prefer the feel characteristics of a silicone gel implant over saline. And many times when I have a patient that's had saline implants in the past, at one time we could only use saline implants, and they come in to have them replaced, for example, for a deflation, they'll often choose silicone gel implants, mainly because of the feel characteristics. There may be less tendency to ripple as well. So silicone gel implants tend to be more popular than saline, but all of our patients have that choice. They can go with either type of implant. Often we use a little higher profile to minimize the amount of side boob when we put in the implants so that we get a little more projection and a little less width.